In this video, we will explore the major arteries from the Anatomy and Physiology 2 lab list, beginning with the arteries of the head and the neck. On both the right and left sides of the body, we see that the subclavian arteries branch and give rise to the vertebral arteries. And it's the vertebral arteries that take blood to a structure at the base of the brain called the cerebral arterial circle, or the circle of Willis. We also see that the right and left common carotid arteries branch and form the right and left internal carotid arteries, which also feed blood into the cerebral arterial circle as well as the brain. On the exterior of the skull, we have the right and left external carotid arteries, which will deliver blood to the skin, the muscles, and the connective tissues that are external to the skull. This diagram shows the major arteries of the head and the neck on the right side of the body, where we see that the brachiocephalic trunk will give rise to the right common carotid artery, as well as the right subclavian artery. On the left side of the body, the left common carotid artery and the left subclavian artery emerge directly from the aorta or the aortic arch. Similarly, the left subclavian artery will also give rise to the left vertebral artery in much the same way that we see it in this diagram on the right side of the body. In this diagram, we see that the internal carotid arteries and the vertebral arteries are the arteries that feed into the cerebral arterial circle, all three of which deliver blood to the brain. The arteries of the upper limbs are a bit more straightforward, with the right and left subclavian arteries becoming the right and left axillary artery, then becoming the right and left brachial artery. The brachial artery branches to become the right and left radial and right and left ulnar arteries, both of which feed into the right and left digital arteries that deliver blood to the fingers. On the diagram, we find that the subclavian artery passes underneath the clavicle, becoming the axillary artery near the underarm, and then as the axillary artery continues down, it becomes the brachial artery as it passes near the humerus. At the elbow joint, the brachial artery then branches and becomes the radial artery, passing by the radius bone on the lateral side of the arm. It also branches to become the ulnar artery, which passes by the ulna bone on the medial side of the arm, and both the radial and ulnar arteries will feed into the digital arteries of the fingers. The arteries of the abdomen emerge from the abdominal aorta, and the abdominal aorta gives rise to the superior mesenteric artery, the inferior mesenteric artery, the celiac trunk, as well as the right and left renal arteries. The superior mesenteric artery delivers blood to the large intestine. The inferior mesenteric artery delivers blood to the small and the large intestine. Meanwhile, the celiac trunk feeds into some smaller arteries, namely the right and left gastric artery, which delivers blood to the stomach, the splenic artery, which delivers blood to the spleen, and the common hepatic artery that carries blood to the liver. And then finally, as their name implies, the right and left renal arteries are the arteries that take blood to the kidneys. In the first abdominal diagram, we see the celiac trunk as well as the common hepatic arteries, in addition to the right and left gastric arteries that are delivering blood to the stomach. And finally, we see the splenic artery here that is winding its way over to deliver blood to the spleen. Here we also see the celiac trunk, which is emerging from the abdominal aorta in addition to part of the superior mesenteric as well as the inferior mesenteric arteries. And finally, in the last diagram of the abdomen, we see the extent of the superior mesenteric artery and the inferior mesenteric artery, which take blood to the large and the small intestines, respectively. And finally, we have the major arteries taking blood to the lower limbs. And all of the lower limb arteries arise from the abdominal aorta, which splits into the right and left common iliac arteries. The common iliac artery then branches again, becoming the external iliac arteries and the internal iliac arteries. The external iliac artery then proceeds down the remainder of the lower limb, becoming the femoral artery, the popliteal artery, the anterior and posterior tibial artery, with the anterior tibial artery delivering blood ultimately to the digital arteries of the foot. Here we see the common iliac artery becoming the internal and external iliac arteries. The external iliac artery becomes the femoral artery as it passes by the femur. The femoral artery then becomes the popliteal artery as it passes behind the knee. And then from there it branches into the anterior tibial artery on the anterior side of the tibia, as well as the posterior tibial artery on the posterior side of the leg and the tibia. This last diagram gives a better view of the popliteal artery and then it branching to become the anterior tibial artery and the posterior tibial artery.